It's pretty grim reading, it must be said, about the impact these shutdowns are having right across the economy, but particularly on those unemployment numbers. I'll take you through this report by the Grattan Institute. They're predicting that between 14% to 26% of Australians will be out of work as a result. This translates to around 3.4 million people. The hospitality industry, as you say, though, it's very stark in that sector. Around 60% of people who work in that industry are believed will be out of work during this coronavirus crisis. That's because it's been forced to close their doors. They just simply aren't able to have the workers in there that they would like to. These numbers, though, won't necessarily be translated into those official ABS unemployment figures. That's because of those wage subsidy, the JobKeeper payment that the government put in place. Even if you aren't getting any hours of work but are captured by that program, you are not counted on the official unemployment numbers. As for the reason why so many of these people are out of work, it's because of those shutdowns, and they will once again be on the agenda for the National Cabinet meeting tomorrow. The Victorian Premier ahead of that saying for his state at least, pubs and clubs are not expected to reopen their doors anytime soon. A little more optimism, though, it must be said, from some of the other state premiers today.
I want to make it clear, though, the notion that pubs are open anytime soon, it's not going to happen. Restaurants, bars, cafes, I just don't think that's going to be. The risk will be far greater than any reward. I think there are some areas we might be able to make some changes in around the way people interact with others, around some of those more social measures.
You know, this is the first day of zero, but if we saw a trend of these really low numbers, I think it's only right that people would be saying to government, what can you do to make our lives a little bit easier?
New South Wales has done a little bit better than we expected in terms of slowing the spread, but it doesn't mean we can relax, I'm sorry to say. We have to keep everything we're doing up.
So, look, perhaps some easing in the future, Trudy, but that's a warning. It's not going to come quickly for a lot of different industries. Also interesting, the situation in Australia is we've handled this so well so far that we've actually got near empty hospitals, and that's led to a call from the Doctors Association.
Yeah, there's a reconsideration now at this National Cabinet meeting tomorrow about the future of elective surgeries. Just last month, the decision was made to cancel all of them. That means for a lot of people, even cancer patients, they weren't able to go ahead with procedures that were already planned. That was for two reasons. Firstly, they wanted to clear up hospital beds right across the country to make sure if there was a surge in cases, there would be enough available hospital beds. But also it was to do with personal protective equipment. The concern was Australia didn't have enough masks and gowns to cater for both this elective surgery need and the surge that we were predicting. But in the wake of not seeing that, there has been a push to reconsider this need. Here was the Australian Medical Association this morning.
The shortage of masks was one of the reasons why elective surgery was put on hold. It was also about ensuring that we had bed capacity and we had about the time to prepare for that COVID-19 surge in demand. We've been so successful so far that that's given us the opportunity now to plan a sensible, safe, graduated return into the low-risk procedures which provide clinical benefit to patients and allow us to not ensure that we have, ramping up waiting lists when we come out of the COVID-19 crisis.
So, Tom, the fact that we are able to now have this discussion about easing restrictions and the possibility of elective surgery resuming just shows you how well Australia is tracking.